So I'll be covering immunotherapy combinations with small molecule inhibitors, and we'll be focusing primarily on inhibitors of the DNA damage response, specifically PARP inhibitors and ATR inhibitors, where there are data both in the treatment-naive metastatic non-small cell lung cancer setting and the previously treated metastatic non-small cell lung cancer setting. And I'll be highlighting data that were presented, updates with regard to the HUDSON clinical trial, which is a multi-arm trial evaluating a couple of immunotherapy small molecule inhibitor combinations, specifically Durvalumab and Olaparib, and Durvalumab and Ceralasertib, which is an ATR inhibitor. This is a trial that's enrolling patients based on their biomarker matched status. So if they have alterations in ATM or DDR, and also in unmatched cohorts. So if they're IO refractory, either primary or acquired. And so there's some interesting data that were presented in which there's some encouraging signs of disease activity, specifically with Ceralasertib and Durvalumab. And this is a signal of activity, which seems to be most pronounced in patients with deficiencies of ATM. So ATM is actually a sister protein to ATR, and both are involved in the DNA damage response. I'll also be talking about inhibitors of the MET pathway, specifically Cabozantinib, where there are data with a COSMIC clinical trial, and where there are actually some confirmatory phase 2 and 3 clinical trials ongoing in the immunotherapy relapse refractory non-small cell lung cancer setting. And I'll also be talking about inhibitors of the TAM pathway. So that's AXL, MER, and TYRO3, specifically Sitravatinib with immunotherapy and Bemcentinib, which is a specific AXL inhibitor.